I'm joined by infectious diseases physician, Dr. Dale Kalina. Thank you so much for joining us on CB24 Live at noon. Doctor, this is probably the last thing people want to hear is about another mutation. What's your take on this? What's your greatest concern?
Hi, Jamie. So it's good to be back. Yeah, you're right. This is the last thing that anyone wants to hear about, particularly when everyone is relaxing for the holidays and that sort of thing. So there certainly are new mutations that are coming out, and there are new mutations that are coming out all the time, particularly those that we're seeing spreading in China right now because of the reduction in their recent public health policies. But at the current time, we already know how to protect ourselves from COVID, from other respiratory viruses, and from new variants. And that's getting vaccines, that's wearing masks, that's staying in when you're not feeling well. And these are the types of things that we really need to be continuing to do.
We're seeing massive spikes in infections in China. Do you think that the federal government is doing enough to, I guess, prevent a lot of those potential infections from arriving on Canadian soil? Do they have to do more to prevent this?
So what we're seeing right now with policies changing in the United States, for example, with swabbing everybody who's coming to the United States from China are a little bit absurd, frankly, not only because in the United States there's widespread COVID, like we have in Canada as well, but a little bit worse. But also we know it doesn't work. So to answer your question, I do think that the federal government here is doing enough to prevent more COVID coming to the country, but that's in a situation where we already have widespread COVID around our entire country. So performative actions like swabbing tests and restrictions really won't help anybody at all.
We've already had, I think we're, 2 boosters, plus we've got the new bivalent vaccine as well. Given the possibility of more mutations, can we expect, I guess, another round of these vaccines, or at least more research into possible newer vaccines down the road?
Yeah, certainly research is ongoing, which is something that we would expect to continue. But the booster doses, those bivalent vaccines that many got, not enough, but many got kind of throughout the past few months, are directed against 2 of the subvariants of Omicron, which is where we're seeing those new variants arising from these days. So some of the new variants are arising from that BA2 subvariant, which one of the bivalent vaccines is directed against, and the others from the BA4-5 subvariant. So all that is to say, get those bivalent boosters. That's what will help protect you right now, and it will help protect you against the variants that we know to exist right now. Ongoing research is always going to be important, but for right now, the things you can do to protect yourself include getting those vaccines.
And speaking of policy, as we move into the new year, China is going to be lifting its quarantine requirements for travelers. They're opening up visa programs. There's, a lot of things where people are going to be a lot of people going to China. They're not going to have to do the kind of things that they did at the height of the pandemic. And I'm wondering if you have any concerns about people from Canada flying to China and then maybe coming back home.
I mean, no particular concerns beyond people from Canada that travel to the United States, for example. We've had widespread COVID circulating in countries around the world, and now that includes China. So for a very long time, because of the very, very restrictive public health policies, there wasn't COVID circulating in China. And that is to say, the public health policies worked. They were really unpleasant and a little bit draconian, but they worked. And that is just to say that traveling to China right now from a COVID perspective is likely very similar to traveling to the United States. So if you're wearing a mask, you're going to be protecting yourself. And a lot of people in a lot of Asian countries, including China, do regularly wear masks. But then the same thing, make sure you're vaccinated. Make sure that if you do get sick, you're not going out and that sort of thing. These are all the policies and kind of good sense that we've been working with for the past almost 3 years now, and we know what to do.
Dr. Dale Kalina, we always appreciate your time and perspective. Thank you.
Thanks, Jamie.